Oh, great. Hey, Gwen, can you hear me?
I hear you.
I'm like, I feel like I'm out here in a room by myself, and I'm going, I really don't even know if I'm connected.
I know you're like, I'm in the wrong place. What am I doing?
I know. How are you doing?
I'm doing okay. How are you?
I'm doing okay.
Yeah. Good. Have you been able to participate in anything, or have you been like too busy to come in and out? Or
Oh no, I've been listening. I've been participating, so it's been great. I think it's been a really good summit.
Has it been great?
Yeah, it has. Y'all have done an excellent job. I can't wait to tell Edie how proud I am of all you guys. Yeah, y'all have done really well.
Getting better every time, right? I was thinking about last year. For some reason, I had pulled up some stuff from last year because that was like 3 weeks after I started or something last year. So
Was it really?
Yeah.
I was looking in, I used to host all the conferences for Summit of the Southeast. It was a big conference, not virtual. It was all in person, but I loved it. I love doing that kind of thing. So I thought, man, I need to get involved in this and see if I can at least help Edie next year,
Do some fun stuff. I know it's got to be some interesting. No, it's funny because as you know, in addition to this job, I sit on the advisors of a couple other things, and one is
I didn't know that
this week. And I think I sent you and Deb Clary something from my personal email because they're going to Louisville. They're going to Louisville or Lexington.
You're going to Louisville?
I think they're going to Louisville. I think I sent you guys, and then they're going to next to NATO. Then they're coming back, and then we were talking about whether they had. And then they were like, well, should it be Louisville or Lexington? I was like, I need to get you guys involved because they have a health disparity index funded by a company called Halogen. And anyway, I've got like 3 hats this week in addition to this one. So it's.
When are y'all going?
Sorry?
When are you going to be going up there?
I have to double check the date. Okay. My head is so full today. I think it's November.
Okay. Well, let me know. I would love to be up there. Deb's trying to get me up there, and I said, as soon as I can.
Oh, yeah, you have to,
Mm-hmm. I'd love it. Have we got any of the other panelists in yet?
No, and that's what I was just working on. We're having, I guess.
Now, are you the one introducing everybody?
Pardon?
Do you introduce?
I don't know what you're doing. I don't think I'm even on stage or was going to say anything. So.
Okay, so I'm supposed to introduce my panel?
Yep.
Okay. All right, because I did that. I went ahead and prepared a slide. And so I'm going to be splitting a screen.
Great.
Mm-hmm.
So what happens is there'll be someone from the production company that will come on and they'll be like, okay, Connie, go.
Okay.
Then you're going to be off and running. When the time is up, so to speak, there'll be a clock, but you really won't be allowed to go over. It's going to be that kind of breakout room where they'll just sort of close it out and send everybody back so they can go on to the next one. Just so
okay.
You know. So there'll be someone kind of moderating that piece of it. So that's good. So who am I talking to? Okay.
It was a little confusing.
Yeah, this part I think was a little bit confusing, and I think it's
Of which link to go to.
yeah, I think that's where it was. Hold on, I need to take a
Go ahead.
call. I don't know where to mute myself. Hello.
Hi, Connie. It's Rafi. How are you?
Hey, Rafi, I'm great. How are you?
I'm good. So I'll be here to help you out with any tech issues. I see Gwen's already in here, so that's good.
Yeah, on the left tab. Okay, I've got a few of them trying to get in.
Okay, let me see if
So
I
I've
can.
got Rachel. She said that brought me to the full
Rafi?
registration.
Rafi,
Hi, Gwen.
sorry to interrupt. Can you hear me?
I can.
Hello. Joyce Salzberg is waiting, and she's very upset that she can't be seen or heard, Rafi. So I'm not trying to talk down to you, but she's on the phone now, and she can't be seen or heard. And she said she's in this panel, she can hear us, but she's asked to share audio and video, and no one has responded yet.
Okay. I do see that she's here in the room. I don't see her icon on the bottom moderation panel. So Joyce, if you can hear us, if you click on the blue button above that says share audio and video, we can get you on screen.
She said she's pressed that, so I can. This I have her on my phone. She said she's pressed it several times, Rafi.
Okay.
Sorry, Joyce, we're getting feedback because of all our computers, but he says that he
All right,
can
let
see that you're
me-
here, but he had asked you to press on that button. I'm sure you can hear him, but.
Okay. Do me a favor, and if Joyce could refresh her browser page and then click on that share button again.
Did you hear that about refreshing your browser to see if that would? Okay.
I think we have an audience in this room.
You do, Connie. If you click on the People tab on the right, you'll
Yeah, I
see
think
all
you
the
hit
people
apply.
that are in the breakout right now.
Okay.
And if you look at the number on the top next to the eyeball, there are 35 people here. Oh, there, Joyce. Okay, now I see her.
Great.
Now we can bring
There
her
we
There
on
you
go.
screen.
are. There's Joyce.
Hey, Joyce.
All right, I'm gonna.
Rafi, you can take me off whenever you want, but now that Joyce is
I'm gonna
on
get
there,
off
Oh,
the
yeah.
phone too.
You can just click leave, Gwen, and you'll leave the
Okay,
screen,
I
but you
will
won't leave
leave
the
you
room.
ladies. I will be in the audience, but I will
Is this
leave
off
you
now?
from the stage.
Yes.
Okay. I know
Sorry.
Rachel.
I just
also
get
trying
so
to-
upset with technology.
Right
if I
in
can't
under the
do it.
wire. All's good.
All right, Connie, I'll be here if you need me. I'll just be on mute.
Yay.
Well, we've got 3 others that we need to pull
Yeah.
in, Rafi.
Okay,
Yeah.
I will find them
Veronica,
and get
Mallet,
them on.
Susan Stith, and Rachel is trying to get in.
He's here again.
Okay, let me
Forget him,
find
Josh.
them. One moment.
Yeah, I gave Rachel the information. Where to go on the breakouts. Joyce, you doing okay?
Yeah, I just need to calm down because I get so frustrated with technology when it doesn't go right for me.
Yeah, it's been a lot going on for sure.
Wow. I'm not great with it. And it's funny because that's part of what I want to talk about is that people have to get more comfortable with it. And I'm one of them that has to do that.
Okay, Veronica's coming on.
Okay, and then I've got Rachel trying to get in. Okay, she said she's here. Rachel is here. Now Susan Stith is trying to get in. I see Veronica. Hey, Veronica.
Hi, can you hear me?
Yes, we can. Good to see
Excellent.
you.
Hi,
Same here.
Veronica.
Hello.
And let's see who else. So is Rachel here? Okay. She's saying she can see us, but she is not in the room.
if Rachel can see us, then she's here. She just hasn't turned on her audio and video. So Rachel, if you could press the blue button on the top that says share audio and video. And if you don't see it, you can refresh your browser page.
Okay, let's see if she comes on. What would we do without the patience of everyone in the technology and virtual sessions? Are we going to be excited when we can go to a conference in person? Okay, she says it's going. But I don't know about Susan, who's trying to get in.
Okay, Rachel should be coming on screen.
Hi.
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 Hi, Rachel.
Nice to see everyone.
Same here. Glad you're able to get in.
Yeah, my screen was taking up the full length and I couldn't see that share part. So thank you for that.
Yeah, no worries. I think we're waiting on Susan to join, and I don't know if she's. Did anybody see a message from her? Rafi, did you see anything from her?
I have not yet. I am sending her a direct message here in Hopin to come straight to this room.
Okay. I want to make sure we're also respectful of everyone's time, and we've got a great session lined up. So I want to make sure we get to all the women speaking and sharing their insights and perspectives today.
Susan Stith sends a message. I'm unable to log into this session. What should I write her back?
I think I can take care of that.
Okay.
I sent her a direct message with the link directly into this session.
All right.
If she's in the main session, she could go to the breakouts also, and it shows women in leadership.
Right.
And she could click on that.
Gotcha. Okay. I'll coordinate directly with Susan if you'd like to proceed.
Okay. All right. Well, let's go ahead and get started. First, I want to say thank you, everyone, for joining us. My name is Connie Mcgee, and I am a healthcare leader that I have worked in healthcare technology now for over 30 years. I'm delighted to get to join WBC today in moderating a panel of executive women and trailblazers in healthcare that's going to share their insights, their perspectives. As a leader, as we've gone through disruption, we're in disruption. And as we all know, we are going to be working in a very complex environment in healthcare, and it will be a constant disruption. So I want to introduce my panel of executive ladies. First, I have Dr. Veronica Mallet, President, CEO of MMC Ventures, Executive Director, Center for Women's Health and Research at Meharry Medical College that is based here in Nashville. I also have Rachel Prosser. She's a principal medical scientist, medical affairs, corrections, military and Indian health services at Gilead Sciences. We also have Joyce Salzberg. Joyce is the founder and CEO of Sunny Days. And then once we are able to get Susan in, we've got Susan Stith. Susan is Vice President of Diversity, Equity, Inclusion, Civic Affairs, Corporate Responsibility, and Executive Director for the Cigna Foundation. And again, I introduced myself, and I am currently an independent director on the Reliant Bank Board as a publicly traded company. So what we want to talk about today is, of course, we've got all these women leaders in healthcare. But if we were trying to look at a theme of what would really resonate would be how we have been leading and how we continue to lead through a disruptive climate of healthcare. So I want to begin, and we're going to talk about the landscape of pre-COVID. You're going to hear a little bit about in the midst of COVID. And then now as we look forward, everything that we're seeing, there is no signal that we're going to be coming out of this anytime soon. If you think about leadership, as healthcare leaders, we shifted from leading in person to a virtual workforce. We've also been moving to virtual leadership. COVID changed our way of life on multiple levels. As leaders, we all had to shift quickly to adapt to the challenges that we were facing with our workforce, how to execute being a positive impact on those we were leading. And as leaders, we also had to reassess our skills and how we evolve those to approach leading through this disruption. If I look at yesterday, if you haven't had the opportunity to join us on the summit, I sit in yesterday and there was a constant message that kept resonating around leadership throughout all the sessions. And that was, I heard about intentionality as leaders. I heard about purpose and passion. And I also heard about work around flexibility with those in which we are leading. So with that, I want to start with my panel. And I want to start with my first question, and I'm going to address it to Rachel first. And then we'll go Rachel, Susan, Veronica, and Joyce. And then we will rotate our leaders as we go to the next question. So my first question is, ladies, knowing the impact these areas have had in the workforce, tell me about your models that you've adopted as a leader, provide your perspectives, your struggles, and how it relates to your leadership within your organization. Rachel.
Thanks for that question, Connie. First, really happy to be here and joined by a phenomenal one on this panel. As a medical scientist in the forefront of the pandemic, I personally had to shift from face-to-face data sharing to meaningful virtual telephone and email communications. To customers' needs, I needed to become proficient in sharing data via the telephone. Sharing complex data in the absence of slides can be daunting. However, I had critical data that was needed and delivered in real time. Sometimes that data sharing came after 9 o'clock in the evening when the providers were leaving the hospitals and on their way home. The data was then utilized for the following morning's COVID command centers and debriefing and clinical decision-making. One of my greatest struggles was to hear the despair and the sadness in the voice of my colleagues. There was so much fear of the unknown, fear of the overwhelming circumstances, and fear of bringing COVID home to loved ones. They were so exhausted. Presumably, many of them still are. The hopelessness and despair was hard for me to hear repeatedly. I think one of the biggest lessons I learned was the imperativeness of being agile and flexible. Rescheduling meetings because providers had a crisis to handle became commonplace. I was communicating at all hours of the day, including weekends. And the lines of when I was working and when I was not working were blurred, this was necessary and it was appreciated by my clinicians. And as I reminded myself, those seemingly blurry lines of when I was and was not working was certainly not worse than being in the front lines.
Yeah. Thank you for sharing, Rachel. And you're so right. Again, flexibility being one of the key words there, and how you were having to adapt your leadership skills. Susan, have you been able to join us yet?
Sure. I believe I'm here. Can you hear me?
Yes, we can hear you, Susan. Were you able to capture the question that was posed?
I'm going to let you come back and give me a part of it.
Okay. So one of the things we were asking is, knowing the impact of all the areas within the workforce, and that your leadership has had to carry people through some of this disruption. Tell us about some of the processes, the models that you adopted as a leader, providing perspectives around the struggles and challenges as it related to your leadership in your organization.
No, thank you. That's a good question. Am I being reverbed? I hope not.
No.
Okay,
I
perfect.
didn't hear it.
All right, so here's what I can tell you. This past year has been one of VUCA, volatile, uncertain, chaotic, and ambiguous. Over the past 18 months, I can say that this is the hardest I've ever worked in this work, because we've been living through triple pandemics. We've been living through COVID, social unrest, political unrest, all of the things that have impacted us inside and outside our organizations. You know, I think that as a leader, I've had to become much more intentional, much more thoughtful in how I work with each of the people on my team. Some have small children, some are caregivers, and they're taking care of family members. I lived through that as well. And it's really pivoting as a leader and being much more flexible and listening, acting, asking what each individual needs, as opposed to making assumptions, and managing to an individual level versus kind of the whole, which is what we tend to do. So this year has been very interesting for me as a leader, because again, the work that I do is really around ensuring that we're creating a sense of belonging and connection. And I had to make sure that I did that for myself and for my team.
Thank you, Susan.
Okay.
And I completely agree. There's so many things that we had to go through with our teams and our individual contributors and just our peers as well. Mental health being one of those that I'm sure some of you had to address through how you engage more with your teams. And it's something, behavioral health, we don't see that changing. It's something we've all got to be very cognizant of. So Veronica, let's go to you. And then give us some of your insights and perspectives. How did you handle some of the workforce and the leadership in your organization leading through this?
At the risk of being repetitive, we at Meharry were definitely in the throes of COVID, leading Nashville's response to the pandemic, and also leading the COVID testing. We were very much engaged on the front line. And so the leadership skills that were critical were the flexibility that's already been mentioned, but the empathy for the city of Nashville and the people who were coming to the testing, who were afraid, but also fearful of losing their job, their way of life, their lives themselves, and the family structure, who were personally affected and just afraid of the impact. And so being overall reassuring, and then being a higher ed institution, a health science center, our students were very much affected because in-person learning was shut off, as was the case for all higher ed. But that meant that sense of community was taken away. And so being accessible to students in a new way by giving out your personal cell phone number and just reassuring them that life was going to return to normal was a critical piece. And then being responsive as the executive director for the Center for Women's Health Research to the call for everything pivoting to COVID research. So we pivoted, and all of our research went immediately to COVID. And our research is looking at the impact of systemic, personal, and institutional racism on access to COVID testing, COVID treatment, vaccine hesitancy, and vaccine access in women of color in 4 different communities. All of that really happened because of COVID and the need for immediate information and how the community was affected and how to effectively respond in meaningful ways to the needs of that community. So those are all kind of real world activities that we had to be very creative and innovative. And I think those are 2 words that all leaders will use repetitively throughout this discussion as key skills to being responsive to this crisis.
Yes, and I agree. Empathy was something that we saw a lot more from corporations and leadership teams across the country. And that was something that was key to us being able to keep stability, retaining our individuals, the students' health, you name it. But I love that I'm hearing 3 different perspectives. And now I want to go to Joyce, because Joyce, you're going to bring a little different perspective as well, no doubt, with some of the things that you encountered. So Joyce, I'll turn it to you.
Thank you. And thank you so much for having me on this lovely panel. And I'm very honored. And thanks to WBC for having this summit. It's really spectacular. But first of all, to just say Sunny Days, I'm from Sunny Days. Sunny Days is a privately held company. I'm an entrepreneur, and the company started 27 years ago in the basement of my home. And now we have a couple thousand employees. So we've grown tremendously in those 27 years. But my point is that my business partner and myself, I believe, we're trailblazers in the healthcare industry. We started something that nobody else was doing at that time. In 1994, we started providing services in early intervention in families' homes in their natural environment. And this was 4 years prior to the federal law dictating that early intervention had to be provided in natural environments. So in that sense, we were trailblazers or pioneers or whatever you want to call us. But I believe we're also visionaries. And here's another pivoting point. In 2012, we decided to do telehealth. And in New Jersey, we're headquartered in New Jersey, but we're in 6 states now. And we started the pilot in New Jersey in 2012, providing to very few families telehealth. And it was a hard sell. Families didn't believe in it. They wanted services in their homes. The service coordinators who had to sell this, so to speak, didn't believe in it either. So they weren't really selling it. And the interesting thing is that we didn't have enough practitioners to provide these services. My practitioners are primarily speech pathologists, occupational therapists, physical therapists, and special educators as well, some nurses and social workers. But the interesting thing about the pandemic is that it actually forced the issue. So something that we were struggling with for so many years, since 2012, was actually blown wide open, and we were able to finally provide telehealth in all of the states that were providing services. So that, if you want to look at an upside of the pandemic, that may be one of them. But I think it's something that says something about women and being visionary in your business, to think ahead, because telehealth is here to stay. I don't care what anybody says, it is here. And the irony of it is that in January of 2020, right before the pandemic hit us, I went to Las Vegas for a conference all about telehealth. And there were lots of hospitals there and some other healthcare providers. And they all went over their stories of how difficult it is to provide telehealth, that doctors didn't believe in it. They would survey the doctors when they first brought it to a hospital, and 80% of them didn't want anything to do with it. And then after a year, it went the opposite way, that only about 10% of them didn't want it. They enjoyed having that. It was an easier modality. But anyway, something that for my message is, I think that we have to be flexible. When the pandemic hit and my industry shut down to go into the homes, we had already been prepared to go into telehealth. And so we were flexible. That doesn't mean that everybody that we employed was trained in doing telehealth. So we immediately began training, I would say 500 to 1,000 people as to how to do telehealth, because it really is a technique that not everybody is going to be good at. And I may be an example. I'm not great at Zoom and looking at the camera correctly all the time. And when you're trying to engage a child in doing activities, you better be on, your best. You better give it your all and get that child engaged, as well as the parent that's there with them. But aside from flexibility being a key to all of this, I think that women in general are no strangers to leadership. So across multiple disciplines, women in the past and in the future have built and will build and maintain organizations. They've created social justice movements. They've governed with compassion and brought order to areas where there was once chaos. So, and I think that we have a responsibility as women leaders to bring on younger women, to mentor them, to support them, not just women, but people of color, so that they too can be leaders in the future.
Yeah, thank you, Joyce. And I couldn't agree more about the telehealth comment. Telehealth has been out there for years. It's just getting the adoption into the hospital systems and clinical side of the house. People just were not as looking forward to embracing that. And that all changed overnight for us when COVID hit and the country had to shut down. So it's good to see that it's here, and I completely agree with you. It isn't going to go anywhere. I think our new norm is what we see now, and it will continue to evolve. Mm-hmm. So with that, let's pivot just a moment, and let's talk about building the pipeline. Okay, so we know in healthcare, we've seen the numbers and we've seen how women have exited the workforce. But at the same time, the clinical shortage, the shortage that we're now encountering in the clinical space and the mandates, especially now with the mandates coming down, we've got a lot of people walking away from healthcare because they don't want to get the vaccinations. So I want to talk to you a little bit about what we saw with the exodus of women in the workforce during COVID. If you look at the numbers since the beginning of the pandemic, we've lost nearly 400,000 women in the U.S. workforce than men. And according to the Bureau of Labor Statistics, all of December 2020 job losses were held by women. According to the National Women's Law Center, by the end of 2020, the labor workforce included 2.1 million fewer women than it did in February of the prior year, just before the pandemic took hold in the U.S. So when we think about how we've met some of the challenges and we've had to and been able to overcome some of the things in healthcare, we still have a long way to go in recruiting, retention of women in the workforce, and how institutions are working diligently to regain women and bring them back in the workforce, and specifically with women of color. So as you reflect on the past and where we are today, where we see moving forward, the pandemic is not going away with the new variants anytime soon. What advice would you look to offer up that incorporates different approaches to build pipeline and retention around diversity, equity, and inclusion for your teams and your company? And let's start back with Rachel.
Thanks, Connie. So in listening to the other women, I think we can all agree that one aspect of a necessary leadership style is grace, right? We all need some more grace on any given day. And I think that with that, if possible, virtual meetings should be recorded. This provides flexibility for women who are working from home, who have been pulled away from their computer to meet the demands of their children, who are home with her, and then she can listen to the call later. I'm sure that we've all been on calls when someone isn't on mute and they think they are, or their decides to pop on screen, or in the distant, yet still very much on camera background. We've all been very, very vulnerable in essentially sharing our personal lives and virtually opening our doors with our colleagues. When I went to the hospital to see patients, no one knew what was happening in my home. And now if I'm not meticulous in how I'm engaging on Zoom, the good, the bad, and the ugly of my abode is available for all coworkers to consume. So I think grace is a best practice that we all need and that we should all sprinkle liberally. I think incorporating boundaries and guardrails around when corporate calls are held, for example, 8 p.m. Pacific time, certainly helps people plan their schedules and their childcare needs. We were allowed to leave our Friday afternoons open and be as free as calls as possible. And I think mostly everyone was very respectful of that. I think that some of these guardrails for corporate calls and being able to block calendars certainly allowed mothers who had people coming into the home or who had limited daycare options prioritize their schedules more effectively and efficiently.
Yeah, you're so right. And I like that answer. Susan, what are your thoughts around that?
You know what? There's so much. We could spend hours just on this.
I know.
Okay, just this one question. So I would say that start with model the behavior that you're asking your team to do. So what that means is if you are going to ask them to take PTO, then you need to take PTO yourself. And oh, by the way, I'm not the best one to model those behaviors, and I'm learning it. Don't send emails after certain hours if you don't want them to do the same. So model the behavior. I think the reality is that it goes back to what I said at the beginning. Acknowledge that every person is coming into this place, this time, in a different way. I'm a baby boomer. My mother's in her 80s. My conversations, my time is very different than the people who are on my team who are early parents. So I just think we have to model our behavior, but at the same time, we have to be, who said that? Grace. Have grace, have
Rachel.
mercy. Those words have to mean something, and we have to live those behaviors.
Yeah, no, well said. I agree. All right, Veronica, what are your thoughts?
So my thoughts are larger, bigger, and more a message to our business leadership. And what I'd like to convey is that this is a huge problem for our nation, and our business leadership, the corporate leadership, needs to really address the policymakers and put the emphasis on the fact that we are the only developed nation that doesn't have a national plan for childcare and yet we expect our workforce to be as productive or more productive than the rest of the developing world, or to be the leaders in the developing world in productivity. And we exclude half of our workforce from that option by not addressing or providing childcare. And that also excludes significant portions of those who are not entitled to or have had the benefit of generational wealth, and therefore the option to pay the exorbitant cost of childcare. And we know that a significant number of childcare providers left the business, and so there are long waiting lists even for those who can afford it. And so affordable childcare, our business leaders need to come together and put pressure on the policymakers that this has to be either an offering of that's supported by taxpayer funds, or an offering that employers offer in order to attract a competitive workforce. And then the second thing I'd like to see is loan forgiveness or loan repayment options. We know that student loan debt is a crippling adversary to wealth attainment and addressing the wealth gap, and that those who are crippled by excessive student loans are those who are the last to come into the educational arena, and very often go towards the for-profit schools because of the option of being in the workforce and going to school in a virtual space. Many of the state schools didn't offer that pre-pandemic. I don't think that will go away, because so much of higher ed has lost their student body and they need to compete. But that loan and indebtedness is crippling for people, and really we need to address the wealth gap. And then the third thing I think is housing stability. Many people are still really going to be affected by the many months of rent that they were unable to pay. Yes, we as a country gave billions of dollars towards that, but we were very poor from a bureaucratic point of view at getting those dollars into the hands of the people that need it. So there is a big swath of the population that still didn't receive those dollars, landlords and renters. And so we're going to be facing those needs. And so I want us as a nation to put together policies to address those so that we can address the housing, education, and childcare gaps that particularly affect women, and in particular women, African American and Latinx and Indigenous women, who will make up the essential workforce that many corporate employers rely on. Not in our leadership, not in the people that are going to be on this call, but those that are going to be doing the manufacturing that many of our corporations rely on.
Okay. All right. And I agree with the, one of the things that you mentioned that I heard yesterday was around the child care piece. And they referred to it as the care economy, caring for your children. How are you going to care for the elderly parents? And how are you going to care for the behavioral health as well? So I love that how they wrap that up into now a care economy that has to be addressed for the workforce and for women, because that was a huge issue and problem and still remains a big challenge for many to be able to stay in the workforce when they've got that to contend with. Let's go to Joyce. Joyce, give me your...
Yeah. First of all, I wanted to mention to Veronica that you touched on so many things that are near and dear to my heart. I'm a licensed clinical social worker by background. So, these are things that are, these are topics that are so important to all of us, especially to women. Mm-hmm. But I'm gonna switch it around a little bit, because my industry, early intervention, which provides services to developmentally disabled babies and toddlers, mainly in their homes, we attract women. These fields are speech pathology, occupational therapy, physical therapy, are still dominated by women. And what I'd like to see in the future is, and it has to start really, I guess, in high school or even before that, to talk to children about these particular professions. We talk about other professions, but I think we need to talk about these professions in the healthcare industry, where we will always need these people. We will always need speech paths. We'll always need OTs and PTs. And somehow the nursing field has overcome this roadblock, so to speak. Higher education, I think, in their career centers needs to do more to help students understand that these are careers that are open to men as well, and people of color. I used, when I first started the company, and for many, many years after that, I would say a good 10, 12 years after that, I was the main recruiter. So I had the joy, and actually I mean joy, of sitting down and interviewing these professionals. And I was always so curious about what brought them into the fields. But primarily I was interviewing women, and they were Caucasian women. And so, and in all these years, it hasn't really changed all that much, unfortunately. So I think we need to do something to change this industry, to open it up to more, as I said, more men, more people of color. And I think it will do a tremendous benefit to the entire healthcare industry.
Connie, can I speak to that?
Sure.
Yeah, if it can be short. We're running short on time, so I got.
Okay, sure. I just wanted to say that that's absolutely right. That and Joyce, there is only one historically Black university that I'm aware of that has an OT and PT school, and that's Tennessee State University. And I think professionally we need to see more HBCUs have those professions in their schools so that you can attract that diversity. Because you're right, if there's a paucity the MD and DDS field, there is it's almost minuscule in those other allied health professions.
Right.
Well, that's a good segue for me to, I know we could talk about this for hours, guys, and I love the content and I love what we've got in the sharing. I've got one question and we're going to have to wrap up our session. One of the things that I want to ask now, as we look at this disruption, as we look at the diversity in a hybrid workforce and a remote workforce that we've all talked about, as leaders in healthcare, what will you do as you go forward to try in your organization or individually or groups possibly? How will you try to recruit and retain diverse individuals and to have an equitable workforce as we move forward, given the fact of everything we've talked about today? So to wrap up, give me a quick 30-second answer if you can. I know it's tough, but just give me an idea. What are your thoughts? What would be the things that you would encourage that we do as leaders to ensure a diverse and equitable workforce as we move forward? And let's
30 seconds. 30 seconds. I'm laughing.
I know.
I'm going to start with the head of our diversity recruiting is on the call. So Amy, that's who I'm going to go to. Starting there. And then secondly, building relationships younger. Somebody said that we really can't start in college. We really have to start in high school or even earlier.
Yes.
And acknowledge that part of the reason we're in the place we are today is because we don't have healthcare professionals that reflect the communities that they serve. That's what I would start with.
Okay. All right. Let's just go around. Rachel?
Yeah, thank you for those comments, Susan. I think intentionality, right? So addressing gaps that you have, addressing disparities in gender and in women of color, and having specific tactics to address those at a corporate level, and making your work environment look like a place where those individuals want to be.
Okay. Susan?
I answered.
Oh, you already answered. I'm sorry. Let's go to Joyce, and then we'll go to Veronica. Joyce?
Okay, well, I think that for the future, I see a hybrid model as being a model for the workplace, both for professionals and for those who are in clerical situations. I think we as leaders, in order to attract anyone, actually, whether it's the gender you're looking for, the race, or whatever, we have to face that by 2030, millennials will make up 75% of our workforce. And that's according to the U.S. Bureau of Labor Statistics. And that generation is looking for flexible schedules, diversity in the workplace, engagement, autonomy, and a meaningful connection to their employer. So we have to keep all of that in mind. And I think if we keep flexible schedules especially, we might help with the daycare issue. It might be somewhat helpful. It's not a solution, but it is somewhat helpful to the daycare issue.
Okay. Veronica, your thoughts?
So I think at Meharry, we are addressing the daycare issue by two ways. First, we did already adopt the hybrid and when we went back approach in terms of a flexible schedule. And we are charged with coming up with on-campus daycare that would be available for Meharry, Fisk, and TSU, which are all in proximity as a viable model for all of those institutions of higher ed, which are predominantly women employed and attended there. And so it'd be open for students and faculty and employees. So that's an approach to kind of attract and retain our workforce and address some of their needs.
Yeah.
Yeah.
Okay. Well, ladies, I want to thank you for joining. I know we had a lot we could have talked about. They just didn't give us the time we would like to have. We can always circle back together, but thank you so much. Great insight, great perspectives. I learned a lot just listening to all of you and walking your journey over the last 18 months. And let's all continue to collaborate with WBC as we go forward. And many thanks to Edie and this team for pulling us all together and hosting a wonderful 2-day summit that we're able to be part of. All right. Thank you, guys. Appreciate
Thank
it.
you.
And have a great evening.
Great panel. You guys are fantastic. Thank you.
You did great.
Bye, everyone.
Bye-bye. Thank you.
Bye.
Bye.